Hello everyone, I'm Dr. Kiran. I'm one of the neonatal intensivist with a very passion for intensive care, and I feel with my friends that we need to offer some help in the current situation of a pandemic. What is the problem? Current problem? Lack of resources, lack of manpower, and the cases are increasing. What is the solution identified? Yes, a lot of patients can be managed at home in quarantine centers, but is it happening? Well, the issue is patients, once you get the diagnosis, everyone still get panicked and everyone still wants to be monitored and cared for. And then that's why they reach out to their family doctors or their friends, or they want to visit hospitals, or sometimes they want to get forcibly admitted themselves, and that is putting pressure on the healthcare system. What can we do about it is we came up with a solution last year with the offering telemonitoring platform for connecting these patients with nurses and doctors in real time. Although there are many hospitals are offering telephone services by calling patients and getting in touch with them, there is no sort of real time way of communication which was existing. So here is our platform, which we think has worked wonders for us, and we've used it for more than hundreds of patients, and we have given very positive feedback. And here how it works. Desktop platform, so the doctor can log in on their own virtual practice manager. The nurses also have their own login, and every team of the member can have their own login to see. And once they go in, patients who are already registered, their names can be seen, and you can go in the individual patients, or you can just go by the category of the patients which are monitored with COVID home care plan. And these are the list of the patients we monitor. Suppose we open the first one. Uh, then the patients can enter their health profile. We can assign the tracker, and we have already created a dedicated plan. And this is how they keep entering the parameters, pulses, etc., vitals and blood pressure, and we can look at these parameters graphically. So as you can see, systolic, diastolic blood pressure, the sugars, and the oxygen level. As you can see, this patient was on oxygen, so was quite fluctuating a lot. And then everything else can be entered, and you can track it. And then if required, a telemedicine call can be also created with the doctor or with the nurse, and can be connected. Now take a look at the patient app. Patient gets their own login, so they can update their own health records, their previous medications, allergies, etc. Then once the monitoring plan is assigned, they can go on their monitoring and enter all the parameters whichever they were asked to do at the frequency which they are advised to. Once the saturations or heart rate or respiratory rate is entered, a notification is sent to the healthcare worker, and if it's abnormal they can take an action immediately. If it is fine, they can just look at the trended data in a graphical format. Now let's take a look at the doctors app. So this is not only doctors but nurses and the administrators also get this login. Once they go to the COVID monitoring, they have all the patients which are there in the plan, and they can keep a track on the list patients by tracking their data in a graphical form in a real time. If they have a concern, then they can set up appointment with them on for a teleconsultation, and they can also write a prescription or order investigations through the app, and patients get a notification when something is ordered. Form and also group of super specialist doctors, and we're covering all the super specialty. Most of our doctors are internationally trained, and they're super specialist and experts in their own qualification. So you have access to uh, connect to these doctors when you need a super specialty consultation along with a COVID consultation. So I urge everyone to use this platform. We are even happy to offer this platform for free, and provided it is utilized in a effective way. And there are many of my friends working in different countries are happy to offer their expert consultations for the COVID and other super specialty for free, as long as it helps the humanity. Thank you very much.